employees and the people they work for safe and to increase protections for the communities they serve. Because we are well past the point where testing is enough to keep people safe. We've tried it. It has not been adequate to the task at hand. Now, if I can turn to the masking order for a minute. We have seen, and this is great news, over the last year how widespread masking can reduce the growth of this pandemic. We loosened masking requirements at a time when our vaccination rate was growing quite rapidly and when our case counts were dropping quite rapidly. But unfortunately now, both our case counts and our hospitalizations are exploding. It is not uniform. In fact, it's very non-uniform across the state of Washington. Some of our areas have in the 80% plus range. Some are in the low 30s. The fact that there's a 50% difference from community to community poses a danger to the whole state of Washington. But we need to have a statewide response to this because every single life counts in every corner of the state of Washington. Therefore, we are requiring all individuals, including the vaccinated, to mask up inside. This updated mask requirement will take effect Monday. It applies to public places, restaurants and offices, shops. It covers everyone in a public-facing setting, regardless of their vaccination status. So in a place that is open to the public, everyone needs to wear their mask in those conditions. It does not cover vaccinated workers who do not have face-to-face interactions with the public in those settings. Now, this is important, however. Unvaccinated workers will continue, as they are today, will still be required to wear their mask in all conditions on the job. This is a job requirement, and it is a safety requirement, even in non-public facing operations. So if you're not vaccinated at this moment and you're on the job, you need to be wearing a mask, whether it's in a public or non-public part of your operation. It also does not apply to gatherings that aren't accessible to the public when everyone in attendance is vaccinated. The mask mandate will also not apply to athletes in indoor sports when they are actively engaged in game or practice. But when they're on the bench or sidelines, we need them to put their mask back on. Those younger than 5 or who have medical conditions that prevent mask wearing are not required to follow this mandate. This will take effect on August 23rd. For those who are frustrated by any of our actions against this pandemic, we need to be really clear, and it is very clear why this is happening. It's because not enough people are getting vaccinated. And the sooner we get more people vaccinated, the sooner we can free ourselves from interruptions, masks, and other interruptions in our lives. That's the nature of this problem. And we are addressing it today by taking action that is fundamentally necessary. We know that masks will help diminish the threat of chaos in our lives. It's going to help us turn the corner and suppress, to some degree, this virus. But we need to be clear. Ultimately, there's one way out of this problem, and it's through vaccination. And the sooner we realize that, the sooner we will get this in a manageable situation. Now, why are we in this position today? Why are we in this fight? In a sense, this is a new fight. In a sense, this is a new virus. The Delta variant presents a whole new challenge to the state of Washington. And just as we said since the start of the pandemic, we've got to tackle the tools, we've got to tackle new threats with the tools we have, and that's what we're doing today. This week, our state broke its previous record for COVID hospitalizations set in December. The rate is, as I said, spectacularly almost vertical in our charts. We're witnessing exponential growth. I've not used that term in some months, but regrettably, that is now the situation that we are in. And the reason is clear. This virus mutated. There's a new game in town, and we have to fight it with the tools we have at our disposal. Hospitals are swamped. Our workers in healthcare are exhausted. They've been doing heroic work for months and months now. Communities are stressed. And I have not seen a single trend that would suggest it's going to slow down in the absence of new action. That means we are in the middle of an explosive threat in our community, and we intend to confront it. And we know vaccines work, we know mask works, and together we know they both are going to help us forge a new path in our state. I also want to point out that this is a somewhat new situation as to who the victims are of COVID. When we started this endeavor, we thought of just those in nursing homes and those of certain age. But that's not the situation anymore. The burden of COVID surge is falling on all age groups, but this virus is increasingly impacting young people. This is because infections are primarily in people who are not vaccinated. And I will remind us that people under 12 still can't get this life-saving vaccine. So when you decide to get a vaccine, you're protecting a kid out there who can't get it. Pretty noble work, it seems to me. We want to send our kids back to school, and these are two steps we can take to make sure we can do this. And I'm looking forward to getting both of this are done. There are roughly 2 million people in Washington who are 12 or are 12 and older, eligible for the vaccine, who have not yet received a single dose. So more of us have to do our part. With that, I'm going to turn to I'm going to turn to Chris Rakedahl, who's a leader in educational efforts. Chris.
Thank you, Governor Inslee. I'm Chris Rakedahl, Superintendent of Public Instruction. I want to thank the Governor for this order today. It comes, as you heard, at a very complicated time in public education, a time where we have learned a lot in the last 18 months. Following the expertise of the CDC and pediatricians, public health officials like Dr. Shaw and other leaders around the country, we know we can open our schools and keep them open and keep our students and staff safe. But we have to deploy tools that are contemporary for the moment we're in. Delta's not Alpha. In Alpha, we had a successful opening of our schools this spring. We got all of our students back in some form. We kept COVID caseloads down. We had success. Delta's different. It is impacting more folks. It's more transmissible, as we now know. And the best tools we have at our disposal are face coverings, which are already a requirement in all of our schools now, which has been announced previously, and now this requirement to get all of our staff and all those who are in contact with our students vaccinated. It is a requirement. We will expect folks to move expeditiously who do not have this unless they qualify for one of the exemptions, religious or medical. This is, in fact, as you heard the Governor say, the best way to keep schools open. Last year was very impactful. We know about it from the great coverage you provided on economic impacts, educational impacts, disproportionate impacts on some communities. In the school setting, we saw the disconnect for a lot of young people. We saw attendance issues disproportionate, and we've shared that data from OSPI. We saw letter grades as one indicator in high school impact students, and we know that we can avoid that going forward and begin the recovery efforts and the hard work of moving forward, and we're doing that. We've deployed $2.5 billion or more in federal dollars. Districts had incredible opportunities this summer that they engaged families in. We are accelerating learning again. And our goal here is safety first and foremost and retaining the opening of our schools and keeping them open. Shutdowns have impacts. To educators all over the state, thank you for the work you're doing. And I use that term broadly. From the bus driver to the person serving a meal to our custodial teams to our maintenance crews, thank you for the work you've done to keep kids safe. I need you to step up again. If you're not vaccinated, please do so and move to do so quickly. You are creating the buffer and the protection for young people and your peers. This is a safe vaccine administered, as you heard from the Governor, for hundreds of millions of people across the country and billions around the world. This is our best opportunity. If we do not do this, and we have to shut schools down this year due to significant outbreaks or even long-term quarantines, students are impacted and ultimately jobs are impacted. And we saw that fall disproportionately last year in our school setting on our bus drivers and others. So they have a lot of reason, I think, to do this and do this expeditiously. Lastly, to the parents out there, I want to say thank you. The ongoing engagement of our public health officials and our governor has been constantly and consistently about making sure our young people are safe. But parents bore a lot of this impact last year as well, especially working moms. When 1.1 million kids are at home, somebody's there to make sure they get through their schoolwork and to navigate their safety needs. And that fell very disproportionately on those often most vulnerable from a wage standpoint or from an equity standpoint. Opening schools is important. It matters to learning, it matters to our economy, it matters to families. Please get your vaccines, please do it expeditiously, or consider a qualification for one of the qualifying exemptions. This is not Alpha, this is Delta, and it requires us to step up in a way we have not done so. I believe Dr. Shaw is next.
Good afternoon. Thank you, Governor. Thank you, Superintendent Richter. My name is Dr. Amir Shah, Secretary of Health for the great state of Washington. I'm going to start by saying we're have a serious situation right now. We are seeing a significant rise, as you have heard, in cases, hospitalizations, and an increasing proportion, in fact, the vast majority, being due to the Delta variant across our state. We should all be concerned about what is happening in our state and particularly in our healthcare system. We're seeing staff shortages, hospitals trying to discharge patients early and divert patients from the care they need because they are simply too full to accept new ones. This is happening throughout our state. This Delta variant, as you have heard, is a game changer. It is easily transmissible and is leading to the vast majority of our cases. While we were hoping people getting vaccinated would be enough, we have seen a few things happen. Washington is one of the top states when it comes to vaccinations in the country, with more than 8.3 million doses of vaccines given out to more than 4.5 million Washingtonians, and that includes 4.1 million who are fully vaccinated. That's still not enough people have gotten vaccinated. There are 2 million people above the age of 12 years and older, who have not started their vaccine series yet. Now is the time, and those who are unvaccinated are unprotected and are truly helping drive up our surge. As the governor mentioned, we've had over 358 million doses that have been administered of vaccine across the country and billions across the globe. Just today, the Health Affairs Journal released a study, and I would ask you to look at it, where 140,000 individuals have been saved, lives saved across the U.S. because of vaccines. So here we are, wishing that we did not have to act as we are today. However, it is a necessary step. We have seen a 20% increase in vaccinations over the last couple of weeks, but that too is not enough. Vaccinations are absolutely the long-term path, but the effects, as we all know, take longer to see, weeks or longer, to see their impact. People are getting sick today from the Delta variant, which means we have no choice but to act sooner. A few weeks back, as you remember, we said consider wearing a mask indoors. Then we shifted to recommend wearing a mask indoors to we strongly recommend wearing a mask indoors even if you are fully vaccinated. To those Washingtonians who got vaccinated or began to wear their masks again, thank you. To protect everyone, those vaccinated and those unvaccinated, more unfortunately have to do the same. We are asking you, as you've heard from the governor and superintendent, we're asking you to do this yet again. Today's requirements for indoor masking for all, with certain exceptions, as the governor mentioned, such as kids under the age of 5 while eating or drinking, actively participating in organized sports, et cetera, will help fight this fifth wave, this predominant Delta wave. We know that masks work. As a tool, it has more immediate impact, and that is what we need to see to turn the tide across our state. We hope this is an interim step and one that can be lifted as soon as we see things turning around. That time, unfortunately, is not today. So I ask you to protect yourself and those around you by wearing a mask indoors and even outdoors if you're in a crowded setting. I also ask you to get vaccinated. Encourage others to get vaccinated. Talk to your healthcare provider. Talk to someone who is not sure and help them understand the importance of vaccines. Masks and vaccines together, we know, work better. But let me close by saying this. We should not fear COVID-19 or the Delta variant. Instead, we should respect COVID-19. It does not care who you are. If you let your guard down, it will rear its ugly head. We are seeing that across our state. So let's respect this virus and especially what we have to do in order to fight it yet again. Thank you.
Thanks, Dr. Shaw, and your whole team who've been working so hard on this. A couple comments. First off, just so I want to make sure people understand this, this proclamation is a legally binding document. Employers will need to comply, shopkeepers will need to comply, business owners now will have a legal obligation in their operations to comply, both to require the use of masks in their businesses and to, as appropriate in the vaccination requirement for their employees. And these are job criteria. So if you do not comply, you will no longer be employed by the affected entities that you're working for. So these are legally binding. The reason I say that is Dr. Shaw was genteel in using words of request and ask, but I want to make sure people understand this is a legally binding order, and it will be enforced in full. I want to say something to the state employees covered by this requirement, too. Look, we really value you. We value the teachers and the bus drivers. We value the people working for our Department of Transportation. It just breaks our heart when we see we lose people's lives who are such great public servants. We just can't stand that. I went to services for a state employee a few weeks ago and realized that I don't want to see other state employees or teachers lose their lives. It's heartrending when it's totally unnecessary. So I want people to know that fundamentally it's because we care about people and it's necessary for their health and safety. But most importantly, perhaps, we are all public servants. We're serving the public. And the public deserves to have people who are vaccinated and who are masks working for them and treating them. And that's the nature of our order today. Before I stand for your questions, I want to address Afghanistan. I know that people are extremely concerned about the people of Afghanistan. I know there are dark days ahead for Afghanistan. I just want to say this. I hope that we will remain holding the incredible American service personnel who've served in Afghanistan over 2 decades, that we thank them for their heroic work, that we recognize their work as honorable, that their dedication is something we respect, and we ought to prop them up and hold them in our hearts and our arms in the days to come, because we know that this has been difficult for them, given their amazing service over these 2 decades. I went through the Vietnam experience. We are not going to allow that to happen again. We are going to hold up in the highest honor the people who've served America during this period in Afghanistan. To that end, I hope that people know, if you know anyone that's having difficulty who's a veteran, the Veterans Crisis Line is available. That's 1-800-273-8255. And counseling and wellness services are available to vets. Also, you can check our Department of Veterans Affairs at dva.wa.gov. Let's help our veterans through these difficult days. Our state will also, as we have always been, doing our part to help refugees from Afghanistan, many of whom who served side by side with our military, to see them back to new homes in the state of Washington. We will not shut our doors to these refugees. We think this is consistent with what we've done for decades, going back to the days of Governor Evans and Ralph Monroe when they welcomed Vietnamese refugees. We will continue in that proud tradition. People who have questions about that can go to dshs.wa.gov regarding the refugee resettlement program. With that, happy to stand for your questions.
For either the governor or the superintendent, do we know what percentage of educators are already vaccinated across the state? And then what agency is going to be tasked with these verifications? And then if there's any sort of details about how you're going to enforce this come October 18th. And then lastly, if a significant percentage of educators in fact do lose their jobs in mid-October, how are you going to handle the staffing shortage at the schools?
I'll take a crack at that, and I'll defer to Chris on this. Look, it is our hope, and I think a grounded belief, that once people think about this, they're going to choose to stay in these incredibly important careers. These are dedicated people, and there's simply no reason to abandon a career when you've got a safe, effective vaccine available to you. And we are confident the vast majority of people will make that decision. If there are a few do not, these are very adroit and dedicated people in the administration. They're going to find a way around this. But that should not happen. And we should talk to our teachers. We love them. We respect them. We need them. We should not allow them to make a decision that's bad for their health and bad for our kids. So I think if we pull together as a state, we're going to find relatively minimal problems in that regard. The process is that by October 5th, we will know who has started their vaccination and who has not. There will be a process that will involve days, not months, where if people do not come in compliance, that they will be discharged. And that will apply to all the personnel that are associated with this protocol, be they state employees or in the K through 12 or college system. And there will be a formal process of their discharge. So this is a serious issue. This is not some suggestion or whimsical idea we're floating. It is a job requirement, and people will be held to account by loss of job if they cannot come in compliance. But they can, and I believe people will. As far as percentages, I've heard different numbers. Dr. Shaw, do you want to give a number, or Chris, or I'll venture one? Chris, you want to take that one?
Thank you, Governor. So, we do a regular check informally. We obviously right now cannot ask employees to tell us whether or not they are vaccinated. This order will change that. They will have to vaccinate and show verification, or they will have to seek one of the exemptions. This is not new to our school system. We have vaccine requirements for our students, and there's a process for that. Local districts are the employers of these individuals. They know how to do this. They will do the verification, and they'll do the checking and confirmations. When we've asked around to folks, they are very confident that our certificated staff are well in excess of 70% vaccinated statewide. We have some regions that report that it's quite a bit higher than that. And then pretty consistent feedback that slightly less than that for some of our other employee groups. Our goal is to get them all vaccinated. Obviously, those who qualify for a medical exemption or seek another one can do so. But our districts know how to do this. They will do the verification. We are not talking about 140,000 folks who still need it, but probably more like 40 to 50,000 of all of our employees and folks who are contracted with us who will need to pursue this at this point in time.
And then just another quick question for you as it relates to the students. I know there's a masking rule in place. Is there any thought of changing either the distancing between seating in classrooms because of the concerns for the students that either aren't eligible or have not yet been vaccinated, or any talk of things like outdoor lunch breaks, or anything to try to mitigate even further?
Yeah, all of those strategies are in guidance that we've already supplied to the districts. We have an outstanding State Department of Health, and you've heard from Dr. Shaw, and you will hear further. They've given us very clear guidance on distancing. The 3-foot framework still stands in place, so districts are planning to a 3-foot distance in classrooms. There can be some variance for that, and we've talked about that consistently with you all. Students are going to move around the buildings, or if it is absolutely essential that districts have to accommodate all families who want to participate and need to be slightly less than 3 feet, they certainly can, only for that reason. So the distancing requirements are in place. You combine that with masking, you combine that with vaccination, you combine that with our cleaning, our screening, our hygiene, and our air quality requirements, and you have one of the safest environments possible for young people. That's how we were so successful last year. But we got up our game. You can't have 30% of your team not vaccinated right now and expect against Delta to hold up to that. And that's why we are where we are today.
Question for the superintendent and question for the governor. For the superintendent, are substitutes covered under this? And if you do encounter a teacher shortage, worker shortage in the fall, what is the state prepared to do to help local districts?
Yeah, substitutes will be included in this. They obviously will have regular contact with students and be in our buildings. They'll be treated like any other employee with that expectation. And the support necessary through collective bargaining to make sure they can go get vaccinated if they're part of a unit. The shortage issues for us are not new. Unfortunately, we always have some shortages in certain areas, different elements of the teaching workforce. We consistently have bus driver challenges, especially when the economy is really good and they have lots of options. So districts are working through that plan. They're thinking through that every day. They know where they can go get talent, but there are some times that are tough. You've seen administrators cover classrooms at times, and they will work very, very hard to replace and fill folks if we get to that point. We don't have to, though. Folks can vaccinate. Some small group will qualify for a medical exemption, and others will seek a religious exemption. We want to protect people's rights. That's what the governor's done here. But the best answer to this is to vaccinate with the safest vaccine we can imagine right now, and folks should do that.
Let me add something, if I can, to one of those other answers. To Rachel's question about the discharge system, the school districts will not have a choice on this. This is a requirement from the state of Washington. So the discharge process that will start on October 5th will be required by the state of Washington, but effectuated by the school districts themselves, because those are the employers. So they will get notices from their employer of discharge at an appropriate date following October 5th, when we know whether people have had their requisite vaccines or not. I'll come to the question that Joe asked as far as the number of people who might leave. We are extremely hopeful that that will be a very small number of people for a variety of reasons. Number one, these are folks who care about the public. They care about, that's why they went into this kind of work. Teachers, bus drivers, they like their work. They like working with kids. They do a hard job, and they're really, really good at it. And ultimately, they're going to have to ask themselves, I'm going to abandon this whole career for a safe vaccine. And if you leave, the vast majority of people will not be eligible for unemployment compensation either. So people will be out of paycheck the day that they're discharged. And as that reality starts to sink in on people, we think more people will have serious discussions with their physicians. And this is part that I'm really hopeful about. The one thing that I would ask, this is not an order, but I would ask it, that anybody who's thinking about this, before you leave your job, talk to your doctor. Don't listen to what all this baloney you're hearing on the internet. There's so much of that just ridiculous information you're being exposed to. Don't leave your career until you talk to your doctor about this vaccine. That's the one thing I'd request. And I hope families will urge their family members in that regard.
And Governor, for you, WSU coach Nick Rolovich, will this order apply to him, and did his disinterest in getting the vaccine influence you one way or the other in drafting the request for higher ed coaches?
No, that situation did not influence us. We made a decision based on the fact that coaches are educators, they're in the educational community, and so they will be treated as other educators in colleges.
Governor, could you first just check the numbers of how many people your actions today cover? I think you put out numbers for K-12, child care, and higher education. And then could you tell us who else is out there? What other groups of workers do you feel you're empowered you could impose a vaccine mandate on if things don't improve? Other groups?
Well, I don't have the second number. We haven't attempted to figure that out. But we do understand the state of Washington has the ability to set safety standards in employment and places open to the public. And we do that. We have standards about fall protection for employees. We have standards about air and water quality in places of public. It's quite vast as the safety obligations of the state of Washington to keep people safe. So it's extremely extensive when it comes to safety, health and safety issues. This is fundamentally a health and safety issue. We're protecting the health of the public. It's like keeping them safe in their food that they eat. So it's very extensive. We're going as far as we are today, but this may not be the end of our efforts if this pandemic continues. As far as the total numbers, I haven't totaled the numbers. I'll get you, it's several 100,000 people just on the ones that we know are affected today. Now, we are hopeful as well that this will influence the broader community for more people to get vaccinated who listen to their friends who might be a teacher who decided to get vaccinated and learn from them. So we hope that there will be a ripple effect as well.
You were talking about this may not be the end. Are you considering going beyond this mandate indoors and expanding it to large gatherings outside, Seahawks games, state fair? Also, do you regret reopening the state June 30th? That kind of gave the wrong signal and we're out of the woods. And the final question is, are you considering a vaccination mandate for students? How can you rule that out?
Well, we're not ruling out any of the reasonable things today. There are multiple things we could do. We're not ruling out any of those things, as we have not ruled them out any time during the pandemic. We will evaluate this every single day to see what may be in the realm of the necessary. But it is clear to me that we are hopeful that these measures will restrain the pandemic. If they don't, we'll have to look at other tools, and we'll make good decisions at the time that's appropriate. Listen, we did the right thing this spring when our cases were going down and our vaccinations were going up, and we opened our businesses and our economy. I think that was the right thing with the information that we had. We want people to go back to work and go back to their lives. And we want to keep that. And basically, we're continuing on that path today. We want to keep our businesses open, and we want to keep our kids in school. And so what we're doing is, instead of shutting down businesses and schools, we are continuing on that path by using tools that will allow us to keep those businesses and schools open, and that's masks and vaccines. So we're kind of consistent in our approach in this regard, and we are most hopeful that it succeeds. There was another question in there, your first one, I'd forgotten. What was your first question? I'd forgotten the first one.
It had to do with a mask mandate outdoors, such as like Seahawks games.
Yeah, well, listen, all of these things are in the realm of the possible. We also continue to listen to the science on this subject. So we're continuing to look at the evidence. Is there outside transmission? We saw a little bit of that at a music festival last week. We're continuing to evaluate that. How much outside transmission do we get? Now, in previous variants, we felt pretty good about outside transmission, but this may be different. We will continue to listen to the science. And this decision is fundamentally based on science. It's not based on politics, it's based on science. It's based on the science of this variant and how transmissible it is. And the fact that it's now getting to the younger ages. This isn't your grandpa's illness anymore. So we'll continue to follow the science in all these decisions. We'll go around this way if that's okay.
Governor, do you mind if I add?
Oh, yeah, no, go ahead.
I just wanted to add to that last question about the outdoor gatherings, that even in the Secretary's order, the requirement is there for indoor settings, as we've talked about, but there's a strong recommendation for, especially in crowded settings, outdoors. So we want to make sure that we're also reminding people, as the governor said, the evidence on outdoors is difficult to partake, but we do know the more crowded it is, the more you're around people outdoors, and if you're not wearing a mask, then you are subject to potential transmission, especially people around you who are not vaccinated. So I think it's the combination of unvaccinated, unmasked, crowded, and being in a setting for a period of time that also adds into the equation. No requirement, it's a strong recommendation. That's correct.
Yeah, Dr. Shah, has the Department of Health looked at modeling of what the Delta variant surge is going to look like in the next few weeks? Is it going to continue to go up? Will it die off quickly like it did in the UK or other places? Do you have any sense of kind of where we're at with that?
Yeah, so great question. It was about modeling and where we are for Delta moving forward. So what we've been seeing in general is that Delta variant has been doubling every 7 to 10 days. So we started off where we were seeing it under 5%, it was by 4.5, 4.8%, and then it went to 9, 10%, 20%, 40, 80, and that kind of thing. Our current proportion is in that 90+%. In fact, our modeling is showing 98% proportion of our cases are due to the Delta variant. So, you know, you don't have a lot of room to go from 98%. I mean, you can get to 100%, you can get to all of it, but really the concern that we have is that the actions that we're taking today is to stem the tide. What we're trying to do today is to say to people, look, this is a game changer. Delta variant is here. We need to do whatever we can to slow things down. Vaccines, yes, absolutely, that's the long-term solution, but it still takes weeks for that to take effect. When you put a mask requirement in place and when you say to people, please do the following things that we've been asking for people to do to be safe, strongly encourage in certain settings, require in other settings, what we're saying to people is that pay attention, the Delta variant is real, and we're very concerned about this because our healthcare system is overwhelmed. We are seeing numbers in our healthcare system. We're getting calls from our healthcare system. We're getting providers who are saying we have staff shortages, we're fatigued, and we're back at this again. So please help us. I hope that helps.
Dr. Shaw, as you
Yeah.
and the governor are talking about the amazingly effective vaccine today, the federal authorities said we're all going to need a booster shot starting in 6 weeks. They have charts showing that the efficacy of the existing vaccine declines rapidly after 8 months. Aren't you going to have trouble making a pitch to those 2 million people who aren't vaccinated today, who then read headlines that, hey, the one we already get isn't working 8 months from now? They just become more cautious. So how do you overcome the hesitancy, and how are you going to get the booster shots out as well?
Yeah, so first of all, thanks for the question. It's about booster shots and what that really means, the announcement from the federal government today. First of all, the federal government made this announcement. We're still looking at the details, and we're going to be getting a lot more details, especially when, as you know, FDA and ACIP with CDC, the committee meets, and we start to get more detailed information about what the announcement means today. But I don't think we're going to have that issue, and the reason I don't think we're going to have that issue is that we all have been saying for months that vaccines are not a forever tool. That the vaccines eventually, there is an effectiveness and there is a period of time where we do know that we are going to likely have to get another booster dose. That's been something we've been saying in the public health community, honestly, right as the time vaccines were starting in the winter, that it's likely we're going to be seeing that. What the federal government today did was to actually put some specificity to the time frame, to say 8 months. This is the specificity that they put into the mix. As far as messaging goes, everything that's out there really does put people have the ability to take information and use it in the way that they see fit. We hope they take credible information and do the right thing with it, but I hope that people do not get this information and then take to it, well, I'm not going to get vaccinated. That is absolutely the wrong conclusion. I'm telling you as a doctor, I'm telling you as a health secretary, I'm telling you as a parent, I'm telling you as a community member. The right message is that we have to get vaccinated in order to end this pandemic. And we do know eventually that we are going to need boosters, and that certainly is what the federal government announced today.
If I could add something to that.
Sure.
Look, the fact that the federal government said we need a booster is good news because it shows they believe that this works. They believe it works. That's why they want to get one in a timely fashion. You know, my brother's diabetic, and you know, he didn't tell a doctor, well, I'm not going to use insulin because I got to take a shot again tomorrow. No, that would be ludicrous. So we got really good news here. This is incredibly effective. I think about this, 95% of the people who are sick today and hospitalized are those people who didn't get vaccinated. This is an amazing product with 300 million plus doses. And the fact that, that a booster will work, to me, is really good news, not bad news.
Governor,
Let me go to the corner here, just a sec.
Governor, school starts in less than a month. We knew the Delta variant Why didn't we call for this earlier? If not earlier this summer, just even last week when state employees and healthcare workers were put on this list? Why have we waited until this point?
Because if I would have, you would ask why I was acting so quickly. Pretty much. That's kind of a facetious answer, but it's sort of an accurate one. We've made decisions throughout here based on science. We've based on the progress of the information we've had. We started with state employees and worked through the protocols necessary, and we're very confident this is the right decision now for the educational community. So in answer to your question, we have made, in my opinion, decisions that have been incredibly effective. We are the 4th lowest rate of death because of this in the United States. So I would say the timeliness of our decisions remain based on science, and so far they've shown considerable success. So I'm not second-guessing the timing of these decisions. I may add an additional component, which I think people sometimes forget. What the public feels about this is very important in our decision-making. We need the public on this, and their public perception is important in this decision as well. You can't issue orders that aren't going to have some degree of public acceptance. So we've been all the way through this calibrating our decisions on how soon can we act that will have a benefit to reduce the pandemic with adequate public support to make sure that they're followed. We think this is that moment to act, and that's why we're doing this right now.
Governor, the location of this news conference was originally supposed to be at Lincoln Elementary School. Was there a specific reason behind why it was relocated here to the state capitol building? And we just heard a lot of those loud voices. They're outside. Would you like to send a message to some people who have said that they're unwilling to wear a mask or get vaccinated and are against the mask mandate as well as the school vaccine requirement?
Well, I would, and what I would say is to folks of this, first off, people have a First Amendment right. It's a freedom of speech, something we take very seriously, and people have a right to voice their opinion about this. So we respect that, number one, and I start there. But the most important thing I would say to people is we really want people to stay in public service. We want teachers to stay in public service. We want nurses to stay in public service. We want bus drivers to stay in public service. The work you do is incredibly important. You're talented. We've invested in training with you. It's important to your families to have financial stability. So we really want you to stay in service with us. And that before you would make a decision to depart a career, the one thing I would say is please talk to your physician about this vaccine. And the reason I say that is that those are the folks who you trust if you get cancer. And this is what's so frustrating to me. How many people go to the doctor and the doctor says you have cancer, but I have a drug that is incredibly effective, incredibly safe, and then say, but I won't take it, doc, because I heard some politicians saying it was a plot to take over America. That simply has never happened and would not happen. And to think that people lose their lives because of that scenario is very distressful to me, to lose people's lives or people in public service. So I would ask, what I would say is, don't necessarily ask for my medical judgment or even Dr. Shah's medical judgment or Dr. Fauci's medical judgment. Don't listen to any of those folks. Go to your physician and ask them about the science of this vaccine. And I am confident that your physician will tell you this is as effective, as safe as anything he or she has ever given you. And when your doctor says we're going to do something, 98% of the time people say, I'm with you, doc, let's get this done. How many people have told their doctor, no, I'm not going to let you give me a tetanus shot? Very, very few. So I just hope people will have that conversation with the people they trust who are scientifically oriented. That's my request.
And then, was there a specific reason why the news conference was moved back here?
Why is it moved back here? I don't know.
Pretty disruptive in the neighborhood. I mean, it's a residential area, it's a school, and we thought it would just be better for the folks there to do it here.
Can I add something, Governor?
Yeah, go ahead.
Yeah, I appreciate the question very much, and it's a good opportunity to remind folks what the governor said earlier. This is an order from the governor of the state of Washington, has the power of law. We've indicated that and consistently reinforced that for our schools. We have incredible school district leaders. We have 1,477 elected school board members who represent their communities who have clear legal authority over the sort of details of educational delivery. But they are not elected to run public health systems. This is an order of the state of Washington and the governor, orders that I support 100%, both masking as well as the vaccination requirements detailed here. For those who have this passionate want to tell folks how frustrated they are, I really respect that. That feedback goes into the decision making. What they ought not do is go to school boards and ask them to do something that is not in the control of school boards and school directors. We can take lots of criticism here. Please keep it civil. Please keep it respectful and safe. We've got email addresses. We get a lot of that. We respond to a lot of that. But your local school board is not making this decision, whether it's mask or vaccines. This is a requirement of the state of Washington with the power of law in a public health crisis where lives have been lost and will continue to be lost if we don't react. Please take your respectful civil discourse where it belongs, and local school boards are not that place. Let them operate school under the law. They're going to put safety measures in place. They're going to ask students to mask up. They're going to vaccinate their teams. They're going to run school and try to keep them open. Respect those public officials, our superintendents, our educators. They need to run schools. They need to run schools, and that criticism can come our way if folks have it, which is legitimate public discourse if it's respectful and safe. Would really encourage folks to respect what your local school boards do, which is the details of delivering education to young people.
Going back to the protesters and what they have been saying, I understand Washington State has the authority for this mandate. What people are really upset about is they keep on saying things like they believe this is un-American or this is violating my rights. Can you just address that point for people who are feeling that their rights are being violated?
Sure. I believe in freedom. I believe in the freedom of our kids to go to school and not be exposed to a teacher with COVID and infect them and maybe cause serious illness of that student. I believe in that freedom. I believe in the freedom of a person to go shopping and not getting infected by someone else without a mask standing next to them trying to buy something at the store. I believe in freedom of people who come into the Department of Licensing and not get infected from COVID from a state employee who has COVID. The freedom from COVID is something that is a freedom that we are protecting here. That's a freedom. That's an American freedom and a Washingtonian freedom. So what I would say is we are protecting your freedom to be alive, your freedom to go to school, and your freedom to do business. And I can only protect those freedoms by doing something that's common sense and safe and effective and based on science. And those are the things that we're doing today. And frankly, some of the things we've done, we wore masks for some period of time, and it had a good beneficial impact. And people have had vaccines for decades, decades. Why this vaccine becomes so verboten, to some degree, is a mystery, but it's certainly unfortunate, and it's not acceptable to the freedoms that we ought to have. Our kids should be able to go to school and not get COVID. And that's what we're trying to preserve by these orders today. Now, the other thing I would say is I feel two ways about the people who have not been vaccinated today. One, I'm frustrated by their decisions for a lot of different reasons. But I have empathy for them as well, and to some degree understanding, because I have the benefit of reading all the science on this on a daily basis from all the research all over the world. But so many of our fellow citizens have been the victims of misinformation. They've been given this steady stream of information about the vaccine that simply is not true. It's demonstrably not true. But they have been exposed to this. And they haven't had access, for one reason or another, to other sources of information. So we're trying to provide them the most credible scientific information. That's why I'm asking people to talk to their physicians. Don't listen to me to that extent. Now, you have to because it's a legal order. But the people you should take advice from is your own physician. And they will tell you several things. Number one, this is a very effective vaccine. 95% of the people in hospitals today are unvaccinated. Number two, they will tell you it's an incredibly safe vaccine. We know this because over 300 million doses have been administered 165 million of people have had it, and there is no evidence of significant severe side effects to this vaccine. It's quite miraculous. And number three, you can get this at any age, and we are increasing numbers of people in our hospitals are young people. And it's of every age. I read today about Alaska Airlines that just in the last month have lost 3 of their employees. The last one was a 53-year-old pilot. You know, he presumed probably decent health if he's flying or he or she are flying airplanes. And here they lose their life at age 53 because they're not vaccinated. So this is everybody's a potential victim of this, either as a victim of getting the disease or being a victim that you have to go through all this work to try to prevent it from spreading. The people who are making legitimately their First Amendment rights out here are imposing a cost on everybody else who has vaccinated, who has to wear a mask right now. I don't find it pleasurable requiring people who are vaccinated, who have done their part, who have been responsible, who have acted on science, now have to wear a mask. I wish it were not so. But we got to get more people vaccinated.
Okay, Bo, and then we have a couple from online, and then we need to wrap up. Go ahead, Bo.
Excellent. Well, speaking to the empathy for those who refuse, who have digested the misinformation and refuse to get vaccinated, it was stated that faculty members who will refuse the vaccine will not receive unemployment. Have you or will you consider some sort of relocation program for those members who have been serving in a public education capacity for them to be recirculated into the workforce elsewhere?
Well, I'm sure there are worker training programs that are available to folks, but I don't anticipate any special dispensation or special program just for these folks who would make that decision. It would be an unsound decision, and it would be a very painful decision. Look, this applies to all educators, not just teachers or principals. It applies to bus drivers, cooks, custodians. Those latter group of people are extremely important in the educational team. They're loved by students and they're respected. They educate students. We do not want to lose them. They do really important work. And so we're taking some steps today and will to try to convince them we want to keep people as part of this team. And I know the vast majority of these people are people who have had medical procedures done. When they're treated for cancer, they do what the doctor says. When they're treated for heart attacks, they do what the doctor says. If they just do that here, we're going to be in a great place. And we're just trying to encourage those conversations.
I think we got everybody in the room. There were a couple questions that came in. Candace Scott with Cairo, maybe this is for Dr. Shaw. What's the current R0 rate if steps are not taken? And then for the governor and Superintendent Rectal, can you address the risk that will continue to exist even if all teachers and staff and large numbers of students remain unvaccinated?
Thanks. So the first, before I answer that question, I did want to make one quick comment, which is important to state, which is our, in addition to the healthcare system, and you heard from Superintendent Rickdahl about the education system, I also want to just mention our local health system, our local public health officers, especially with mask requirements. I've seen unanimousness with our local health officers saying that they were urging the state to have a mask requirement statewide. So I just want to make sure that we recognize that while we're doing things at the state level, we're also coordinating and partnering with our local public health system as well as our healthcare system. And our local public health officers have been very clear about the fact that they believe that right now, given what we're seeing across the state, that this is the right move. As far as the R0 goes, as you know, we have been watching this throughout this pandemic, and just for everybody who isn't familiar with this, under 1 is good, above 1 is not good. That means that you're actually able to you're gonna continue with the pandemic and have more people potentially infected that you can transmit to. And we have actually seen the R0 rise over the last couple of weeks. I don't have the exact number today, but I will say that it has been in close to the 2 range, and that has really been concerning to us. We've been seeing this sharp increase in the R0, so infectivity or transmissibility has been increasing over the last few weeks, but it has certainly taken an increase of late that has been of concern. So before I step back, was there another question for me?
Can you address the risk that will continue to exist even if all teachers and staff are vaccinated if students remain unvaccinated?
Yeah, and so I just got, our R0 was 1.67, just so, thank you for that. What I wanted to just make sure, 1.5, it was 1.67 last week, and now it's 1.5. So, yeah, there's risk, right? We have kids who are under the age of 12 who are unable to get vaccinated, and they are going to school, and we all support the fact that in-person education is better than virtual, and we want to do everything we can to have our kids be safely in person. But the problem or the challenge that we've had is that when kids go to school and they are unvaccinated, then masking really is one of your tools. But the other tool that we have is adults that are around those kids, and whether that's in a school setting or a setting out of school, meaning the rest of community members, to get vaccinated, that's how you can protect children. And that is so key for all of us. There are many of us who are parents, grandparents. We want to make sure that we protect our children who are ineligible for vaccine. In our discussions with the federal government, it does not appear that anytime soon children are under the age of 12 are going to be opened up for eligibility. So that means that we have to do everything we can as adults, as community members, to be able to protect our children. Thank you.
I wanted to add something Chris talked about. For people who disagree with some of these requirements, the school boards or the principals are not the place to take complaints because they do not have authority to alter this requirement. They are subject to the requirement that the state of Washington has issued. So people who do have complaints, my office is the right place to direct them to. And so that's the place to raise your voice if you have concerns about these orders. The school boards are just simply do not have the authority or the ability to alter them. And I'll look forward to further discussion.
Last question.
Last question from Crosscut. This could be for any of the speakers. Is there a scenario where in-person classes go remote again? What is plan B if cases continue to rise?
Well, I'll just take a crack at that. This is like all of the questions we've had throughout this pandemic. We will remain alert to what's going on in this pandemic. We hope like heck that these measures we're taking today are successful. But there are 1,000 different alternative courses out there that we can't foreclose today. It doesn't do us a lot of good to think about them because they haven't happened. We've got to focus on the here and now of what we can do. And what we can do is use these 2 tools today to avoid even the potential of what would happen in that question. And these tools are available to us. They're free, they're safe, they're effective, and we ought to help all of our friends and neighbors and relatives use them. We're helping people along in that regard. Chris, do you got anything else you want to add?
One addition, and maybe it kind of pairs with the question earlier as well from Hannah Scott. Our school districts, more than 200 of our school districts are also part of what's called the Learn to Return. It's a wonderful partnership with the Department of Health and the Health Commons. These are districts who have built custom plans on testing when they think that's an appropriate measure, or vaccination clinic sites. So that is still available to all districts. For the last 95 districts, if you want to do this, please contact us. We'll put them in contact with folks. The reason that's important is because what we saw last year with those partnerships is the quick ability when a student or a staff member is a suspected COVID case to make sure we get a test done right away, to get that information quickly to public health officials locally, to make sure that we go through those protocols on contact tracing and then quickly contain that. And we saw that virtually all of our outbreaks last year in cases were 2 to 3 students, or maybe 2 students and a staff member, where we could move quickly, move them to quarantine, and continue on with our learning. And that's what we would expect here. It's like a chess match, though. Delta has dealt us a very strong move by our opponent. So masking and testing alone wasn't enough. We now have to move to a vaccine requirement and try to get more people to build that protection. And as the governor said, we'll keep responding as necessary. I do not anticipate the need to shut down schools at all this year, but that is a function of how we behave. If we don't vaccinate, if we don't wear masks, if we don't do as much as we can to respond when there are cases, that's the natural result, because nobody in the state of Washington is going to expect us to keep schools open if there is massive spread of this thing and the hospitalization of individuals, adults or students, and God forbid the loss of life. What we do today matters. We is greater than me. And we have to wear face coverings now everywhere we go. We have to vaccinate at much higher levels, and we have to look out for each other. And that's what Washingtonians are going to have to do to get this thing so that we are the strong position in the chess match.
Final words, Governor, we'll wrap up.
Just that throughout this pandemic, Washington has had several things we've followed. We have followed science, we have acted together, and we haven't been afraid to take bold action, and that's what we're doing today that's necessary. And I'm confident that if we continue to do these things, if we help our relatives talk to their physicians, we're going to be in better shape eventually, but we need to do that. My one request today is I've acted as governor. These have not been easy decisions. I have not relished making them, but I'm confident that they are based on science and preserving life and allowing our kids to go to school. Those are good things in our state. The one thing I would ask for people is for everybody to be a leader here. I just happen to hold one office, but everybody in our state is a leader. You're a leader in your families, in your churches, in your businesses. I hope you'll talk to your people who you care about this subject. Urge them to talk to their docs, and then make a decision. We want everybody to keep the ball rolling. That's what we're doing in Washington. Be well. Thanks. Oh, and by the way, before I forget, I'm really sorry that I forgot this. Our forest firefighters right now, I want to thank them for the work they're doing. They are incredibly stressed. We're kind of in the middle of fire season. I just want to thank them. I'm telling you, we're going to do everything we can to support them. It's going to be a long several weeks for us. If you can find a firefighter, buy them a cold soda because they need some help. Thanks.